Dr. Jessica, Jason, yeah. We're here with a large team. I think everyone will really appreciate to learn more about the results from your research. So please, yeah.
We talked a little bit about presenting some information about this concept of thinking about the elevation of the eye across the entire ocular surface. And so I just wanted to present you a question to think about. If you had a patient in your chair who had, let's say, 4 diopters of corneal astigmatism, and you were going to fit this patient in a corneal RGP, where would you put toricity in that lens? Would you only put it in the very peripheral curves of that lens to fit, or wouldn't you put it in the entire lens? Nobody puts toricity to compensate for corneal toricity only in the periphery of their corneal lenses, and that's what we do with scleral lenses. Now, the move towards more customized and freeform lenses allows us to change that. So we have this notion in our head of the cornea looking like a Pringle, because we know that it's not the same diameter in both meridians, and we also know that generally it's not the same elevation in both meridians. But the reality is it doesn't really look like a Pringle, right? It looks, I mean, it's still a hill, and so the area that's elevated is not really elevated. It's actually just elevated relative to the reference sphere of the cornea. And so what we end up with is we did a poster at GSLS that kind of investigated the differences in sagittal height at different chords. This is a scleral lens on an eye and probably looks pretty nice, but you have to realize that I'm using my thumb to hold this thing in a centered position. And in this nice centered position, if you look at the limbal clearance on temporally over here and nasally over here relative to superior and inferior, I think we'd all agree that we have more limbal clearance above and below than we do at the sides. And then again, that's because our corneas at the limbus, or if you don't want to be quite so nitpicky with this, fraction of a millimeter difference in corneal diameter, just at a 12 or 13 millimeter chord across the entire eye, we're generally more elevated at 3 and 9. And we're generally more depressed or steep at 6 and 12. And so this is the fit it gives us in many cases. It gives us a situation where we have excessive clearance in the vertical meridian and less so in the horizontal. And then what that ends up with is, once we don't hold our lens in a nice pretty position anymore, is we end up with this thing, right? The lens drops because of gravity, and we get this inadequate clearance up above. And the reason for this, again, is really just because we're not landing on the eye in a place where the lens can grab onto the eye itself in a proper location. So I have a couple different patients up here, and I just wanted to show you some differences. So this is a patient, and she's cool with you guys knowing her name because she's a long-term patient of mine. But she been in sclerals now for about 4 years, and she just is a simple hyperopic astigmat. She's about a +6 -4. And if you look at her map, you can see how toric her cornea is. And if you actually look at the numbers, if you look at the minimum and maximum sag at a 12 millimeter chord, which is basically the end of her cornea, she's running about 230 microns of elevation difference at the limbus. Now, if I were to take this up to 17 millimeters, you'd see it's about 430 at the end of the contact. So historically, when we fitted her in lenses, we had to compensate for 430 microns of elevation difference, but we had to do it entirely in the haptic, instead of building it where the toricity difference actually is. And so when I refitted her this year, we refitted her into a bi-elevation lens, which basically just means that we took that 430 microns of difference that we had previously built into the haptic, and we put about half of it into the vaulting chamber of the lens, so that it was built into the peripheral or the mid-periphery part of the scleral. So not in the optic zone, but in the zones between the optic zone and where the haptic starts. So we added 200 microns of elevation difference internal to where it landed, and then the other 230 was in the haptic. So we're putting the elevation differences in the lens where they are on the eye, and it creates a more centered fit and a more aligned fit and less tendency to flex and less tendency to drop. So again, you have the capability on your instrument of looking at sagittal height differences. You can type in any chord you want. Again, this is a 12 millimeter chord, and you can see the difference here of about 230 microns. If I took this up to, I don't think I have quite 17 of data, but I think I have about 16.7. And now that difference again here is about 430. So in this case, if you take a moment and look at the sag height differences at the area approximately where the lens is going to land on the cornea, or on the limbus, sorry, on the sclera, you can decide, how much of my elevation difference is internal to the point of first landing versus how much is external to the point of first landing. And in this case, this is a patient who's better served with, for me, a bi-elevational lens, which again just means that some of the elevational difference in the two major meridians is put internal to the point of the lens first landing on the eye. So this is a patient very different, as you can see by her cornea. She's quite spherical. I think she has less than a diopter of astigmatism corneally, but she's very against the rule in her sclera. And so in this case, this is somebody where the vast majority of the difference in elevation between the two meridians is in the scleral zone, not in the corneal limbal chamber of the eye. And so this patient would be better served with just a standard spherical base curve, spherical lens with all of the toricity being built into the haptic, because that's where it occurs. If we check again her chord length differences here, again, she's 260, 330 microns of toricity in the eye at 16.7. If I took that down to about 12, again, that number drops to about 100. So this is, again, somebody who may or may not benefit from a bi-elevational lens. But looking at these chord length differences at different diameters gives you an idea of where does this elevation difference between the two eyes come. And if, again, that elevation difference is happening inside the area where that lens is vaulting, then is it helpful to build in some of the elevational difference inside the landing as opposed to putting it all into the haptic? So any questions about that? Hopefully it's a very conceptual talk, but
Jason, I have a quick question.
Yep.
Do you have a specific number in mind where you look to do that?
I would say if it's, I don't have a specific number. Historically, I'd say 100, because when you order a lens like that, they're typically going to build the sag difference in 50 micron steps. Well, 50 isn't really that helpful. I think about 100. When I see 100 microns of difference at about a 12.5 millimeter chord, I'm going to look to go to a bi-elevational lens.